Here's an alarming fact. The average age that someone has their first heart attack is unfortunately 65 years old. And while not every heart attack is fatal, they all can cost a similar amount. Some sources say that the average cost for the treatment of a heart attack is around $53,384. That's why in this video, I'll show you how much Medicare covers in heart attack treatments and how much you'll spend if you're on an Advantage plan versus a Medicare supplement plan, and which are the best and worst types of Medicare plans to have if this situation happens to you. Let me start with the worst plan to have if you have a heart attack. And that worst plan is Original Medicare Only. If you have Original Medicare Only, you're in the worst situation. Some people don't want to get a Medicare supplement plan. Some people don't want to have a Medicare Advantage plan. They think that now that I'm 65 years old, I can switch to government health care, a government health insurance plan, and can finally do away with private health insurance. I can get rid of my group plan. I can get rid of my Obamacare plan or whatever it is that they have. And they think, well, I'm paying $185 a month for Part B, so that's enough. I don't want to pay more than that. Unfortunately, people who do that are putting themselves at a very high out-of-pocket risk. If you only have Original Medicare, you're responsible for paying 20%, or roughly 20%, of all of the costs out of pocket. So let's just say that you're one of those unfortunate people that has a heart attack. You're going to be rushed to the hospital in an ambulance. You're going to get an emergency chest x-ray, probably a CT scan, several other tests, a stress test or other things. You're going to stay in the hospital for probably 3 days. You may have to undergo cardiac catheterization or a stent placement procedure or something around your heart. And your total bill for that is going to come out to roughly $19,500 after Medicare negotiates with the hospital. If you have Original Medicare Only, here's how much you're going to have to pay. Many of the emergency services that you receive in this situation fall under Medicare Part B. That includes, for example, the ambulance ride. It may include some of the testing as well, and some of the doctors that visit you in the ER. Medicare Part B has a $257 deductible that you need to pay first before it starts covering you. Now, that doesn't sound like that's going to be too bad. I mean, $257, we can handle that, right? But unfortunately, once you've paid that, Medicare is going to cover 80% of the remaining costs. And that means that you're going to be responsible for the remaining 20%. That brings your out-of-pocket, in this example, your out-of-pocket roughly up to $845. That's $257 Part B deductible, and the additional $588 that we're doing in this example. Now, your inpatient hospital stay, that falls under Medicare Part A. Medicare Part A has a deductible of $1,676 before it starts covering you. So you have to pay that up front. If you stay at the hospital for longer than 60 days, then you'll also have to pay a $419 copay every day that you're in the hospital, and it gets more expensive the longer you stay. So if you stay over 90 days, it's even more. Thankfully, in this example, we said that your inpatient stay is 3 days, so Medicare is going to cover all of those costs once you've paid your deductible. So your out-of-pocket cost for your inpatient stay is only $1,676 for your Part A deductible. Finally, there's the catheterization and stent placement procedure. Now, here's something really critical to know. If you're fully admitted in the hospital, both of these procedures are going to fall under Medicare Part A. But oftentimes, these procedures may happen later. Maybe you're stabilized and then you have the surgery. In the case that they're happening in the hospital, you've already paid for your Medicare Part A and you're not staying past 60 days. So you won't have to pay anything else for this procedure because it's covered under that hospital stay. However, if you also are stabilized in the hospital and then have the surgery a few days later because you've gone home and now you go to have the surgery, then these procedures are going to fall under Medicare Part B. Now, if that's the case, you'll be responsible for paying 20% of the cost for these procedures, which comes out to a whopping $1,940. So for this example, let's just say that it falls under Part A and hope that that's the case if this ever happens to you or someone you love. Now, it's very important to know that whether you're fully admitted to the hospital or not has a big impact on how much it's going to cost you. You don't want to be observed in the hospital. You want to be admitted to the hospital because it can have a big impact on how much you pay. Okay, so let's go back to the figures. This brings your out-of-pocket total to $2,521 if you're fully admitted. Now, that's why we do not recommend staying on Original Medicare Only. Yes, you might be able to save some money on premiums, but if you have a heart attack, you could be on the hook for a very, very expensive hospital bill. Now let's say instead of having Original Medicare, you went with the Medicare Advantage Plan. The biggest pro of Medicare Advantage Plan is that a lot of them have a $0 monthly premium. So you're saving a lot of money in monthly premiums. You only have to pay your $185. That's what it is for most people in your Medicare Part B premium. And there's no additional monthly cost. However, with Medicare Advantage plans, they are private insurance. So there are 3 things that you need to know about what they cover in the situation of a heart attack. First, they can choose the pricing for their services and for the services that you would need in the case of a heart attack. And by pricing, I mean that they will have copays and coinsurance. The difference is copays is a fixed amount. A coinsurance may be a percentage, but they choose how much those are. So think of it like going to a restaurant and saying, let me look at the menu. Maybe I want to order the lobster today. How much does it cost, right? There is a cost for each service. That's different than when we talk about a Medicare supplement later. So some plans will have really low costs for a situation like a heart attack. Other plans may have higher costs. So we need to look at how much you'll pay if you have a heart attack, and we're going to do it on an average Medicare Advantage plan. And since this is private insurance, you're not going to have to pay the 20% of Medicare. You're going to pay the costs associated with your plan. So instead of having the 20% for co-insurance, most Medicare Advantage plans will have a copay for ambulance services. They'll have a copay for x-ray services, a copay for CT scans, and every plan will have different costs. But here's what a plan may look like. Now, for full disclosure, I have made these numbers up based on some average plans I've looked at. These are not real figures. This is just to give you an idea of what we often see. So for an inpatient hospital stay, again, a Medicare Advantage plan is private insurance. You're not going to have to pay the $1,676 Part A deductible anymore. Instead, your Medicare Advantage plan usually has a daily copay for inpatient hospital stays. They can structure this in different ways, but a lot of plans will have a copay of roughly $350 a day for days 1 through 3, or 1 through 5, or 1 through 4, something like that. So in the example of a $350 daily rate, that would be $1,050 out of pocket for you on a 3-day stay in that example. Now, finally, for the stent placement, it falls under Part A, and this includes your daily hospital stay. So you would not have anything additional for those things because there's no additional billing. It's all part of your hospital stay with your Medicare Advantage plan because it is covering all of your costs in the hospital under Medicare Part A. Okay, so remember you had to get to the hospital in an ambulance. You're going to have to pay for that. And an average copay, let's say, is about $250. The chest x-ray, the CT scan, the stent placement, all of those procedures, they are going to be covered in your daily copay. So if you put all that together, you have to pay $1,050 for your daily rate. You're going to have to pay $250 for your hospital stay, and that comes up to $1,300 total. Now, the second thing that you need to know about with the Medicare Advantage plan is that they have networks of doctors and hospitals that they work with. So during emergencies, your plan is going to cover your treatment anywhere that you go, in or out of network hospitals. Because it's an emergency, they'll take care of you. However, once the emergency is over, you need to go to an in-network hospital or you need to go to an in-network doctor to continue to receive care. If you don't, you could be subject to higher copays, or the plan might not cover you at all. Now, don't be worried. They will tell you if you need to go, and they will plan this with you. It's not like they will say, oh, well, you should have moved. No, it will be planned for you. There will be a point where you're stabilized, and they will say, okay, it's time for you to move somewhere. But if you're going to go to an out-of-network hospital, it's critical to make sure that you're only doing that in a case where it's an emergency. Now, finally, the third thing that you need to know is that many Medicare Advantage plans require prior authorizations for things like catheters and stent placements and things like that. This means that your doctor may have to submit a few requirements. Now, if it's an emergency and your life is in a threatened situation, then all of that goes out the window. They're going to do what they need to do to save your life. But once that's over, there may be some things you need to work through with your doctor. Your doctor may need to work through the steps to have approval for additional surgeries or other things that are needed. Now, most of the time, it's not going to be difficult to show this, especially if you've had a heart attack, right? But it's important to know that prior authorizations can sometimes be a hassle to deal with. And a lot of people think of prior authorizations as being only a Medicare Advantage thing. But the truth is prior authorizations exist in all insurance plans of all kinds, group plans, Obamacare plans, Medicare insurance plans. And in fact, it's even being added now to some procedures in some states for original Medicare. Okay, going back to Medicare Advantage. Medicare Advantage plans usually have very low premiums, oftentimes a $0 monthly premium. And when it comes to the copays for coinsurance, you almost always pay less with the Medicare Advantage plan than you would pay on original Medicare only. Almost always. It's not a steadfast rule, but almost always. So that's the summary of Medicare Advantage and the 3 things that you need to know in the situation where you have a heart attack. Let's move now to a Medicare supplement. What if you want a plan that has a low out-of-pocket cost, lower than original Medicare, but without the networks, without the prior authorizations, and without the Medicare Advantage plan? You could go for a Medicare supplement plan. The most popular Medicare supplement plan today is the Medicare Supplement Plan G. However, there is one big problem with the Medicare Supplement Plan G, and that is that it can be very expensive monthly. The national average for a Plan G is around $150 a month when someone's turning 65. There are some areas where it can get maybe down to $120 a month, while in other areas it can be $300 a month. But let's say that $150 a month when you're turning 65 is your national average. And remember, you still have to pay the $185 a month for Medicare Part B. And that brings your monthly cost up to $335 a month every month, even if you don't use the plan. But here's why so many people choose this plan, even though it's very expensive. With the Plan G, it doesn't matter how expensive your bills get. The only thing you have to pay is your $257 Part B deductible. Let me show you what this looks like. When you go to the emergency room, you pay the $257 Part B deductible, and that's it. It doesn't matter what the total bill is. It doesn't matter, like the $3,200 in our example. It doesn't matter if it's $100,000. You only pay $257. Isn't that great? That's because a Plan G covers absolutely everything except for the Medicare Part B deductible. Now, when I say absolutely everything, I'm leaving out prescription drugs. Those are on separate plans. But everything for the hospital, everything for the surgery, everything for the stent placement, all of that is covered. With the Plan G, your out-of-pocket expenses will come out to a grand sum of $0. That was after your $257 deductible. And that's why so many people are willing to pay the Plan G's high premiums, because they want that coverage and be able to go to any hospital and any doctor that takes Medicare, particularly in a situation like that where it's an emergency. So let's recap. If you consider your heart attack and how much you would spend, a Plan G easily wins on the cost out of pocket. Although the plan costs as much as $335 a month because of the Part B and the plan premium, the low out of pocket cost brings it way down and like 3 times lower than any of the other options. So for this situation, you could say a Plan G looks pretty good. However, if you take a look at the bigger picture and you look at your total cost over the year instead of just for that one moment, assuming that you never go to the doctor again, you'll realize that a Medicare Advantage plan can actually cost you a lot less over time in the long run. Yes, you have to keep the plan's network. You have to have prior authorizations and keep that in mind, but paying $335 a month for a Medicare supplement, that can get very expensive. And I didn't even touch in this video, but Medicare Advantage plans also have prescription drug plans built in and a bunch of other perks like dental, vision, hearing, over-the-counter item coverage, etc. And that's why there's never a clear winner, whether it's a Medicare Advantage or a Medicare supplement plan. There's never a clear winner between the two because it depends on you. But there is a clear loser. The clear loser is original Medicare. No one should stay on original Medicare with no other coverage. But when it comes to a Medicare supplement plan and a Medicare Advantage plan, it's important to know how each plan reacts if you have a heart attack, so you'll know what to expect if something like this happens to you. Now, if you'd like to know how these plans react if you have cancer, which is very different from how they work when you have a heart attack, then watch this next video.